Hi there. And welcome to InfoCo. Have you ever felt pain in your muscle or tired all the time? Or do you have a constant respiratory infection like flu or bronchitis? Is there something wrong with you? Or are you just lacking the amount of vitamin D? Are you having enough of it? Let's learn more about vitamin D and how important it is to your health. Here are the 10 most usual symptoms that usually happens to vitamin D deficiency. Number 1. Muscle fatigue. Muscle weakness can present as generalized body fatigue. If you're experiencing a more general fatigue around your body, muscle weakness issues in specific areas may stay hidden and go unnoticed for months. A symptom of a muscle pain is usually centralized to one point and is exaggerated by movement or physical activity. General aches and pains, if not taken care of, may become muscle and bone pain, and tiredness may progress into chronic muscle weakness. Number 2. Bone pain. When your bones have grown to its fullest, new bone tissue constantly replaces the old. Severe vitamin D deficiency interferes with that replacement, leading to the softening of bones known as osteomalacia, which causes pain and increases of osteoporosis. Avoiding sunlight and dairy products can leave you with a vitamin D deficiency. Pain can sometimes be difficult to distinguish whether it is a muscle or joint pain. However, there are some indicators that can help differentiate bone pain from muscle pain. Number 3. Fatigue. Without vitamin D, you can end up feeling tired most of the day. Continued tiredness can contribute to other symptoms caused by low amounts of vitamin D in the body. If you feel tired, you're less likely to exercise or go outside. Listen to what your body is telling you. Something might be seriously off if you notice that you just don't have the drive or strength to stay active anymore. This will make it hard for you to get around or even get to work. Avoiding activity or sunshine can amplify the effects of a vitamin D deficiency. You should consult your doctor if you have constant feelings of tiredness that last longer than a few days.
Number 4. Chronic pain. Researchers began looking into the link between chronic pain and a lack of vitamin D. If you experience chronic bone or muscle pain in a widespread manner throughout your body, it could be due in part to a lack of vitamin D. Studies have now shown that low vitamin D levels increase a person's chances of having chronic pain. Supplements can sometimes help relieve it, but if it doesn't help, talk to your physician about the best way to boost your vitamin D intake. Number 5. Constant respiratory problems. Constant respiratory problems may present in different ways. Studies show that vitamin D may help defend against respiratory illness, and this is especially true in children. You may want to increase their vitamin D intake. Often, a person suffering constant respiratory problems will also suffer from an anxiety disorder, like panic attacks. This problem may turn into a chronic respiratory illness, and it is strongly recommended that you visit your doctor for professional advice. Number 6. Chronic infections. Vitamin D has significant effect on the activity of more than 200 genes in our body, so it's no surprise that the strength of your body's immune system is also tied to how much vitamin D you are taking in. Your immune system is resilient and able to fight off infections, diseases and viruses when your body is healthy with enough vitamin D. Chronic deficiency of vitamin D can be devastating to your overall health and leave you vulnerable to constant attacks and health problems. Number 7. Hypertension. If you do suffer from anxiety, you may want to consider purchasing vitamin D supplements and adding them to your daily routine for that reason. Vitamin D has been proven to have positive effects similar to antidepressants and may reduce your overall blood pressure. Studies that considered the deficiency of vitamin D with cardiovascular disease and hypertension or pre-hypertension. There are more studies included the viability of vitamin D supplementation as a treatment for patients with hypertension and pre-hypertension. All hypertensions will require an official diagnosis from your doctor. Number 8. Reduced endurance. If you're seeing your endurance decrease for no apparent reason, it might be because you have low vitamin D levels. Active people who get outside every day can experience these issues, despite getting more than the recommended amount of sunlight per day, about 20 to 30 minutes. Even in athletic circles now realize that vitamin D is crucial to energy levels, especially when it comes to endurance. So, if vitamin D deficiency is causing your issues, it is recommended to get your vitamin D levels back to normal. You don't always need to opt for pills to get your proper dose of vitamin D. Try a supplement in powder or liquid form to mix with your smoothies or protein shakes. Number 9. Chronic kidney disease. Kidneys are the organs that get rid of the waste in your blood. Doctors have discovered how important vitamin D can be to your kidneys' health. Your bloodstream can fill up with waste, seriously damaging your health if they're not functioning correctly. As you get older, your kidneys are not as efficient at processing vitamin D. Ensuring that your kidneys are working properly to process vitamin D is just as important as getting your proper nutrients. Be sure to eat some vitamin D-rich foods or take a supplement. If you do take a vitamin D supplement, it is recommended to take vitamin K2 to activate the right proteins in the digestion process. Number 10. Cardiovascular disease. Cardiovascular diseases are heart conditions that may include damaged blood vessels or frequent blood clotting. Some cardiovascular disease-related symptoms that are easier to spot are dizziness, heavy bloating particularly in the legs, respiratory issues, and chest pain. If you're experiencing any of these symptoms, you should contact your doctor immediately. Articles published by the National Institutes of Health have shown that deficiencies in vitamin D can lead to congestive heart failure. In summary, vitamin D is vital to our well-being in our muscle, bone, heart, kidney and importantly respiratory system. During the COVID-19 pandemic, vitamin D is very important to keep our respiratory and immune system in their best shape. This nutrient can be obtained by eating vitamin D-rich foods or take supplements. Try a supplement in powder or liquid form to mix with your smoothies or protein shakes. If you do take a vitamin D supplement, it is recommended to take vitamin K2 to activate the right proteins in the digestion process. We hope you enjoyed and find this video useful. Share your thoughts and comments below. If you enjoyed this video, give it a thumbs up and share it with your friends so we can keep making them. For more videos like this, hit the subscribe button and remember to click on the notification bell. Also be sure to check out other of our videos as well. Thank you for watching.